and I will go ahead and get started. Good afternoon to everybody. I'm very excited to be here, and I'm glad that you are all here joining us as we plan for the 2022 Homeless Point in Time Count. Once again, we are recording the meeting. If you have to step out, we will make sure to share the link. Please remember to always mute your mic when you are not speaking. And we will go ahead and get started. My name is Laura Gonzalez, and I am assisting with the coordination of the Homeless Point in Time Count for 2022. Thank you so much for everybody being here. Hopefully we can get a lot of planning done today and learn a lot more about the Homeless Point in Time Count. Next slide.
Sorry, it froze.
That's okay. Did it freeze?
Yeah, let me share it again.
Sounds good. Thank you, Monique. Okay, sounds good. Once again, welcome. I see a lot of our partners. I've been communicating with a lot of you through email, and I'm glad that you are all here today. Thank you. Next slide. Just wanted to share a little bit about the agenda today. Today we have Barbara Cole on the line, who is going to be speaking to us regarding COVID-19. We will review some planning updates and summaries. We've already had 2 meetings, and I wanted to provide as many updates as I can. We will review a timeline and important dates as we continue to plan for the pit count, and then we will have the planning session breakout with planning session reports. Once again, just looking at each component of the count and doing our best to make sure that we address all of them. As you all are entering your information in the chat, please also, if you could let us know what areas of the count are of interest to you. If you are wanting to break out into the youth group, just let us know. We will also be having the survey and methods work group today, as well as the housing and services linkages initiative work group today as well. So we will work on that during the presentation today. Next slide. Okay, so as promised, we are going to go ahead and share Barbara Cole's PowerPoint and give her the floor so that she can talk to us a little bit about COVID-19. I know I've gotten a lot of questions from our partners about how we are going to address the point in time count during this time of COVID-19. So we have asked Barbara to share a little bit of her knowledge with us and provide some recommendations. So we will go ahead and bring up Barbara's presentation, and then you can just let us know, Barbara, when we can when we need to move the slide to the next slide.
All right, thank you. Good afternoon to everyone, and again, thank you for your participation. I'm sure people have heard a lot about COVID-19, but I just want to highlight some of the things I think is key in terms of ensuring your safety. And of course, we want to be concerned about the homeless persons living with homelessness that you will be outreaching to. So I'm a registered nurse, public health nurse. I'm director for disease control with Riverside County Public Health. Next slide. So just brief background about coronavirus so that we are all on the same page. You'll hear the term COVID-19, but COVID-19 is part of a group of coronaviruses. Some are very common among animals and humans. In rare cases, the animal coronavirus can be transmitted to humans. So when there's a new virus that the general population isn't used to, it is referred to as novel. So this is a novel coronavirus, the COVID-19. It was newly discovered and had not previously been detected in humans. So when we think of coronavirus, no, there's lots of them. There's some that actually cause like just a common cold, but we're concerned specifically about COVID-19. Now, generally, human coronaviruses cause mild to moderate respiratory illness. Sometimes people have no symptoms at all, and yet they can still be infected. So the pandemic, meaning global worldwide illness, is being caused by COVID-19. And we know, unfortunately, multiple countries have been impacted, so multiple cases, multiple deaths. So it is something we all want to take seriously. Now, as of November 14th, for the state of California, over 4 million cases had been diagnosed or reported in California. And unfortunately, again, over 72,000 individuals did die. Next slide. So just to give you a feel for what we're seeing in Riverside County, something about statistics, no, you put them up and already the next day they're out of date. But this is as of our data on Friday for the county. You'll see 421 cases have been reported of COVID. We track how many new cases each day. So on that particular day of this report, we had seen 490 new cases. And again, deaths, over 5,000 deaths. I think this is just for Riverside County. We are looking at how many people have it and get over it. So we call that recovered. So we have a lot of people indeed who have had it recovered and are doing well. We look at, however, hospitalizations as well as intensive care unit, and that number's been fluctuating. So we were headed where it looked like, things were going great. So if you look at the bottom slide, the bottom of the slide for cumulative COVID, you'll see the peak was early last year when we had so much COVID. It leveled off with only a few. We had another peak in mid-August, and we're hoping it's going to level off again. So this slide is just one day if you're interested in tracking the number of cases. They're found on the public health website, and perhaps we can put that in the chat after. Next slide. Now, there's lots of common symptoms that might make you think of COVID-19, but some of these symptoms could be representative of other things. So when you think of fever, chills, headache, cough, sore throat, you might also think of influenza or flu, similar symptoms. It could be some other respiratory illness. We get concerned when we're seeing these symptoms, plus someone's having trouble breathing, or they're very short of breath. Sometimes people have nausea, vomiting, diarrhea, but maybe that nausea, vomiting, diarrhea has nothing to do with COVID. It could be that they have salmonella or Shigella, hepatitis A. So different diseases can present with similar symptoms. One of the symptoms, though, that should make you think COVID-19, because it's not due to other illnesses, is a new loss of taste or smell, where the person is telling you that they can't taste their food, they can't smell, say, their perfume, shaving cream. That's pretty indicative of COVID-19. Someone might have red, itchy eyes. Could be allergies. When people have allergies, they have red, itchy eyes. Could be if someone had a rash and they have red, itchy eyes, we might think about measles. They can have congestion, runny nose, could be a cold. It could be allergy. So it's a combination of these symptoms that should make us take pause and, of course, take appropriate precautions. Next slide. Now, the other thing to note is symptoms may start 2 days after exposure, but can be as long as 14 days. And that's referred to, most of you are probably familiar with the term incubation period, right? So 2 days after exposure, but can be as long as 14. Most people or some people will have illness or develop a positive test somewhere in the middle, 5-7 days. Again, stressing, some people have absolutely no symptoms. And people think because they have no symptoms, they're not contagious, meaning they don't spread the virus to others. However, asymptomatic people who test positive can still spread the disease to others. And of course, we know, unfortunately, particularly in an elderly population, people underlying health problems, they can have severe illness, and sometimes it is fatal. Next slide. So diagnosis and treatment, as I mentioned, these symptoms could be due a variety of illnesses. So the testing is very important to know, do we have COVID-19 or do they have the flu? Do they have some other respiratory illness? For mild symptoms, usually they're treated with just basic over-the-counter medicines that relieve the fever or pain. When people have more severe symptoms, though, that is when people usually end up being hospitalized. And if you're following all the media, there's lots of different treatments. One of the newest ones is monoclonal antibodies that for people with mild symptoms who have not had to be hospitalized, if that's given within 10 days, it greatly reduces the severity of illness and usually will keep that person out of the hospital. So we're not trying to give you all the ins and outs of treatment. Just know they're out there for yourself, for your family. Always check with your healthcare provider about the different options for treatment. Next slide. I will have the slide just to let you know, although we're talking about COVID-19, there's over 80 conditions that can cause disease or illness, and they must be reported to the local health department by hospitals, physicians, nurses. So you'll see the way this chart is divided is the urgency of the follow-up. So even though right now we're not seeing measles, measles is a disease that's spread very rapidly, highly contagious, and so we expect to get called, even if it's night, even if it's a holiday, for follow-up. So you can look at this just to get a feel for all the different types of things that must be reported. So when you're out and about doing, your teams are out and about doing outreach, don't only think about COVID, realize there could be other things that could present a risk in terms of safety. I don't know how often people encounter animals, but we're concerned, of course, about, say, bats. We have bats in our communities, which often test positive for rabies. So you want to be a bit aware if you're in an environment or your teams and they see bats, they want to take precautions to avoid them. Now, for rabies, in general, dogs and cats in our communities don't present a risk for rabies, but bats, raccoons, coyotes, they do. So depending on where people are, is it a rural area, just be aware of the surroundings and the potential for animals to present a risk and not just think about COVID. Next slide. Now, a good tool we have now are all the various vaccinations. So COVID vaccine has been approved in different stages based on different groups. So there's Pfizer and Moderna vaccine. They currently are a 2-dose vaccine where people get it at different intervals. And then J&J or Johnson & Johnson has been a 1-dose. The new thing is the children 5 to 11. So if you see young children when you're out and about, or your team's out and about doing outreach, there is a vaccine moving forward for 5 to 11 years old. And I'm sure you're all hearing all the discussion around booster doses, third doses. So our various public health clinics, outreach clinics are geared up to offer booster doses as well as to offer vaccine at certain locations for children. For children, obviously, it requires the parent consent for vaccination. If you get questions or your team, you can refer them or give them information about the different vaccines and how they obtain them. Vaccine is going to help us if everyone gets vaccinated to hopefully come out of this pandemic. Certainly, whether or not to get vaccinated is an informed decision each adult has to make and each parent has to make for their child. Next slide. So I have flu vaccination in here. We're just at the beginning of influenza season. It's another respiratory illness that can be spread to others. Unfortunately, people are hospitalized, they can be in ICU, and there can be fatal cases. We do recommend, this would be for volunteers, outreach staff, that they consider getting an influenza vaccination if they haven't, also the COVID vaccine if they haven't, to make that informed decision. And for flu, it's 6 months or over. Everyone 6 months or older are recommended to get a flu shot. And because different strains of influenza circulate each year, it is important to get a flu shot each year. So again, we expect you guys yourself, as well as your teams, that you have that discussion with your healthcare provider if you have questions about flu vaccination. Flu vaccination and COVID vaccination can be given concurrently. You would just use different sites, like perhaps one in the left arm, other one in the right. Next slide. So just kind of a quick bulleted list of safety precautions, because that's what we want to talk about. How do you or your team stay safe? So number one, this is for everyone. Outreach should not be conducted unless people are well. You know, some people are real troopers, they want to come, they want to help, but please message to them the importance of staying home if they're sick. So if someone has a cold or flu-like symptoms, stay home until 24 hours, at least 24 hours after fever and any other symptoms are gone. It's important, as people are doing outreach, to sanitize their hands after every encounter. And ideally, you want to have running water and soap to wash hands. But in the meantime, if you're in a location where you can't do that, sanitizing hands is very important. Public Health does recommend that people doing outreach wear a face mask, right? So when you're conducting interviews, lots of things around the governor's executive order, the state public health officer order around face masks. Face masks provide a barrier. It helps reduce droplets getting into the air that someone else might breathe in. And it helps you, the wearer, also from breathing in air potentially containing those droplets. Now I have gloves and face shields in parentheses, not mandatory, but it's another level of protection. So people really want to look at what they're doing. You know, gloves protects your hands, but you still need to wash them. Face shields, some people may feel more comfortable having their face mask and a face shield on. So we've had this discussion with Laura and her team about, we're not saying mandatory, we're saying if indicated or you feel more comfortable, or your team, then to look at having that available. What's not okay is just to wear a face shield without a mask. The face shield does not replace wearing the mask. So if people want to choose one or the other, it should be a face mask. Hugging and shaking hands. Some people are very interactive with people, but we really discourage hugging and shaking hands. Again, not just COVID, maybe someone was sneezing, their hands, they didn't have the way to wash their hands. You're shaking their hands, you touch your eye, you touch your mouth, nose, it can allow the virus to enter the body. So no hugging or shaking hands. We really discourage that. If people are wearing masks, if it gets saturated, maybe there's they sneezed or it's just saturated because they've been wearing it too long, then it really needs to be changed. So we would look at having additional masks available for the volunteer to change their mask. And then if they change their mask, they really need to sanitize their hands afterwards, just in case that mask is contaminated. And I mentioned how things can enter your body through touching your eyes, nose, or mouth. So we want to stress this with the volunteers, avoid the touching, washing their hands, sanitizing their hands. And then maintain a distance of 6 feet apart and limit interaction to 15 minutes or less. So when we, as public health, when we're assessing, has someone had an exposure, we're looking at, were they within 6 feet from another person who was, say, infected, and was the time spent in that interaction 15 minutes or more. So it doesn't have to be 15 minutes all at once. It is a cumulative. So for these interviews, people may not be spending a lot of time, but let's say there was 10 minutes and then the person had a question and they came back, they needed more information. So then the person spends another 5. That's a cumulative 15 minutes, and it could be over 24 hours. In this instance, it's going to be during the time that that interview is taking place. So you're thinking about how close people are. If someone is visibly ill, one of the persons experiencing homelessness, ideally you would not want staff doing that interview if they're visibly sick. They're coughing, they're sneezing, they don't have a mask. And I did speak with Laura that it would be helpful if volunteers had some masks. So if someone was symptomatic, that they could indeed hand them a mask to cover their cough. And remember, it's not just the mouth, it has to cover the nose and the mouth, and be under the chin and fit snugly enough that droplets are not escaping around it. Next slide. So COVID-19 is definitely a challenge. I think in past years when homeless counts were done, we didn't have this challenge. But containment is such a challenge because it's, you remember I said, people who have no symptoms, they don't know they're infected, can still spread the virus. So that's why it's so important to maintain the distance, to wear the mask, to do the hand sanitizing, because you don't know who does or doesn't have it. The other thing I mentioned is that a person can actually be contagious 48 hours before onset of symptoms or their positive test. So whether a person has symptoms or not, if they test positive, when we look at exposure, we're going back 2 days from that positive test or 2 days from the onset of symptoms to assess who could have been exposed. And obviously, when people are exposed, we have to look at placing them on quarantine. When people are positive, then they're on isolation. And in most instances, that's a period of, we say 10 days plus 1, because the 10th day ends at midnight, and we would not lift their isolation until the next day, the 11th day. Someone on quarantine would also have to stay well. Are they well still? They did not become infected. That's all important as you do homeless outreach, to know that everyone's safe, that people are doing things to keep themselves safe. Because if someone goes out and they're not vaccinated and they get exposed, then they become infected. They present a risk to their families as well as co-workers and other volunteers. Most people are hearing about post-vaccination and variant cases. So post-vaccination, people are fully vaccinated, they meet that criteria, they get exposed, and indeed they can contract COVID again. And the thought is most of this is due to variant cases of variant strains of COVID-19. So there's lots of different types. However, the one we're most concerned about at the local, state, and federal level is the Delta variant. it is spread more easily to people. The vaccine does still work, but people can contract variant strain when at first they didn't have one that was a variant. Very important as part of outreach that, and I'm sure this will be covered, that volunteers are able to really recognize someone that's experiencing signs of serious illness, right? So they're trying to do an interview. This person is gasping for air, or their lips are blue, their face are blue. So part of the volunteer training is to really cover these things. And when it's 911 call, who do they talk to about 911? And then just stressing to all the volunteers and staff how important it is to follow all of the safety instructions they're given. It's for their protection. Next slide. So that concludes my presentation. I do want to, Laura, are we doing questions now or later? What's the plan?
Barbara, questions now would be great.
Okay, maybe you can tell them about raising their hand. I'll try and fill them.
Sounds good. Okay, so we have a hand raised already. It's Jacob. Go ahead, Jacob.
Hello, thank you so much for the presentation. This was really great. My question is, some of the individuals that I have been encountering don't want to get their vaccine because they're afraid of the side effects, and not so much what the side effects, do long term, but in the short term, because they get sick or uncomfortable or chills or fevers. Do you have any suggestions, or maybe other people know of places they might be able to go to sort of wait out the symptoms in case they need, medical attention, or a way that I can sort of incentivize them to get their vaccines and not worry as much about the symptoms? I hope that makes sense.
You're talking about individuals experiencing homelessness and where can they go if they have an adverse event. One thing that should happen when a vaccine is administered, whoever's giving it is supposed to have that person wait at least 15 to 20 minutes, because most serious adverse events occur in that amount of time. Now, there can be delayed things, but usually the most serious things happen if they're going to be truly allergic. But some of the issues that follow a vaccine, of course, they can have headache, local site pain, body aches, and feel like they have the flu or coming down with COVID. But it really doesn't usually last but 1 or 2 days. The challenge is, where do they wait? Where do they go to rest, to be there, to get some Tylenol if they need it? There's not a good solution to that. There's limited housing for individuals who need isolation because they test positive. And we as public health don't have a good system in place for those who are experiencing adverse events because of vaccination. Most people do well. We do find following the second shot, sometimes they feel it more. So I don't know if Laura has any suggestions in terms of where they could go if they've gotten not to an ED because they're not sick enough for that, but you mean where can they go to rest until those symptoms pass?
We could definitely look into that and see if we can come up with some suggestions or ideas of where they can go. Anybody, any partner on the line that has any thoughts about that as well?
All right, well, I think it's a good point. And again, the population we're trying to serve and interview, there's different challenges because they don't have a home to go to and lie down and rest. So we'll explore that and try and get something out. Thank you for that question. Any other questions?
Yes, Barbara, there's a question. Does the type of mask matter? And so the question is, for volunteers, your recommendation is that they use a face mask that covers both their mouth and their nose. Does the mask, does it have to be a specific type of mask? Is the question.
I think the key is that if they're using a regular non-medical mask, it needs to be 3-ply, 3 layers, so that it filters appropriately. Ideally, what would be best would be what's referred to as a surgical mask. Is more medical, not the N95 respirator. We're not recommending those at this point because people aren't fit tested, they can be hard to breathe. So depending on what's available, the ideal one would be that surgical mask. But let's say it's a regular non-medical grade, as long as it's 3-ply. There's 3 layers. It helps filter, keeps the droplets in and keeps droplets out, would be the recommendation. And it needs to fit appropriately. So if it's too loose, again, it's not doing the intended job.
Thank you, Barbara. There's another question. It says, how has Riverside Public Health not enforced mask wearing?
Why has Riverside Public Health?
Why has Riverside?
I'm sorry, I'm not typing. I'm Jose from FAP. I have a question for the nurse. Why hasn't Riverside, San Bernardino County enforced wear masking like LA County? LA County, you go outside or you go to any store, they enforce you to wear a face mask. The question I ask is because, as you stated, there's still the Delta variant, and we have had clients here at our agency that have had both shots and have passed away due to COVID. So my question to you is, with all due respect, is what is public health waiting for the numbers to increase in order to enforce mask wearing? Like you said, I mean, especially now with the count, I mean, we're going to be on the field. We're working with a very vulnerable population, and yeah, I mean, my concern is people are not wearing face masks. And face masks have been very effective on lowering the case of COVID. So my question to you is, why has the public health, both San Bernardino and Riverside, not enforced in other counties like LA County and Orange County are doing it?
All right. Well, I can't speak for any other jurisdiction like San Bernardino or Orange County. There is a state public health officer order that it says people must wear masks. We do follow that order. We apply that order. But I think what you're saying is, why isn't there a local public health officer order for masking? There is the state one. We expect people to follow that one. But I hear what you're saying is a little bit different than LA recently issuing theirs. But there is an order. It's just at the state level, and it applies to all jurisdictions.
And thank you for your question, Jose. I would just like to ask that we keep our questions to Barbara germane to the pit count. I know we have a lot of questions and concerns outside of how COVID affects us on our day-to-day, but I just would like to, remind us that the conversation and the questions are specific to the point in time count. And again, thank you for the question. It is very important. And so if anyone else has questions for Barbara regarding her expertise and how it applies to the pit and us interviewing volunteers, please come forward. This is the time to do so. Thank you.
Thank you for that additional comment. Appreciate it.
Okay, so I actually have a question for you, Barbara. Once again, we are working to make sure that the count, that we can use volunteers for the homeless time count. Point in time count, and just making sure that they're safe, but at the same time that when they approach individuals in the streets, that person won't be intimidated as someone comes up to them with masks and gloves and all that. And so ideally, I think if our focus is to just make sure that all volunteers commit to wearing the face mask when they are conducting the interview, then that would be sufficient on public health, your perspective.
Yes, we had that discussion. I mean, face shield and mask affords greater protection. But if people are doing the social distancing in terms of how close, short, and keeping the interactions more limited, then yes, as long as they're wearing the face mask, the gloves, the face shield, I think you would want to have a limited number available because there might be some volunteers who want it. Maybe they have some underlying health issue that they don't want to share. They want to help, but they want that additional level. So we had this discussion from a public health perspective, should be made available if requested by the volunteer, but we're not saying it's a must. Versus the face covering, they really should wear those, or the face mask.
Thank you, Barbara. And that brings me to my next question, which is proof of being vaccinated. We don't know, or we would appreciate any feedback you have. We are going to be recruiting community partners, community volunteers, and do we want to ask individuals to provide proof of vaccination, or do we just encourage them to only to have volunteers that are vaccinated to participate? What are your thoughts about that?
Yes, so we did have that discussion. We recommend that you either have people show proof of that they're fully vaccinated or have a recent test. Now, we don't want to discourage people from participating in this count because it is very important, but you also don't want to have someone potentially that's infected who does not know it. So I think you look at your rules that you must follow in terms of outreach for homeless, but that is standard. We also talked about the possibility of attestation where they sign something saying that, yes, they are vaccinated and you don't actually require them to show you. So in the state health officer order, though, there are some settings that must show it or be tested. And healthcare workers are one. There's some things for homeless shelters. These are unsheltered, so whether those rules apply, I would have to look at that further. But if people are vaccinated, hopefully they are willing to share that, because that way you can feel more confident that hopefully are protected. Again, we know there's post-vaccination cases, and we know about the variant. I see another hand. Question, but you're on mute.
I guess it's me. Hi, I'm Gina Estrin. I kind of want to weigh in a little on this because from a liability standpoint, I mean, that was why they canceled the whole point in time count last year. I really think that you should require proof of vaccination. I know a lot of people have wonderful hearts and want to help, but you're exposing them to the possibility of being exposed from one of the people that they're interviewed by, and then the person that they're interviewing, if the interviewer happens to have been recently exposed, could be spreading it. I really personally strongly feel, I mean, it's not going to stop me. I am vaccinated. I will bring my vaccination proof, but I think that's really important to determine for real that a person is properly vaccinated. That's it, my comment.
Thank you for that comment. And we tried to find, that's our recommendation as well, but we tried to find some, middle ground that allows people to be safe. And I don't know if anyone else with the HHS program wants to comment.
I will tackle that. I really appreciate your feedback. We have been proponents of vaccines for our homeless providers and their staff and for our residents. I think that we continue that's a journey that we're on to get us up to much higher vaccination. And in an effort to, include as many staff and others, we landed on the spot that Barbara just spoke of, where a test and the vaccination are what we're going to move forward with. In our best of possible worlds, we would want everybody to be vaccinated. But as we're in this middle world, getting those vaccines out, that's where we landed on. But I really appreciate your comment.
Yes, thank you for that comment.
Thank you. Thank you, Carrie, for that. Another community partner is asking some public-private spaces take the temperature of people entering their space. Would this be helpful for the point in time count and any place where volunteers gather before going out, which would be to the deployment sites?
We are not currently making that as something we feel is a must do. Remember, some people can be totally asymptomatic. So then you're thinking, oh, no fever, they're fine, and they could still be positive. You also have to think about who's taking that temperature. Are they using a digital no touch? How is it hot? There's so many variables that can impact the reliability of that temperature. I think the screening in terms of are you well today, we do that for staff. Early on, we were doing temperature checks on everyone, but we currently feel there's other ways to screen people. So it's not something we feel that you must do. But if you chose to do it, then you need a good mechanism. You need the right type of thermometers. You don't want people getting closer than 6 feet. There's just so many variables that go with taking that temperature.
Thank you, Barbara. Any other questions related to volunteer participation and COVID vaccination and safety precautions? We are definitely in the process of purchasing protective equipment for all volunteers. And so we will make sure to provide these to all of our deployment site leaders for the day of the point in time count. This will include the face masks, plenty of face masks, as well as hand sanitizers for all the volunteers that are going to be canvassing the communities. We will also make sure to provide some extra face masks in case there is a volunteer that encounters someone that they start the survey and the person starts coughing or the person starts showing some symptoms, that they would be able to hand that face mask to the individual. But of course, in the volunteer training, we will make sure that volunteers understand that if someone does not look well, that it is not recommended that they survey that individual. Let's see. I know there's a hand up, but I don't see who that person is. Oh, Yanel. Yes, from the city of Indio. Good afternoon, Yanel. Go ahead. You are muted.
Hi, Laura. Yes, so our question is, what are the recommendations that you guys are giving when transporting volunteers?
Are you this is Barbara. So you're talking about you're transporting them to the area that they are going to be doing the surveys.
Yes.
Ideally, you would not want a bunch of people in one vehicle, because if one of them has it, it's an enclosed environment and it could spread. If someone's positive, it could spread among the other volunteers in that vehicle. Now, again, I know there's concerns about caravans and, we don't want people to be concerned about what's happening. The safest approach is not to have multiple people in one vehicle. But if you are going to do that, you want to limit the number so you can have some spacing and that everyone indeed would wear their face covering. And if we're checking if people are vaccinated or negative, it's decreased risk. Then,
are you guys suggesting that each volunteer drives their own vehicle?
Well, in the best of all worlds, that would be the way to get them there. That might not be practical. So if you have multiple people, limited, like if you have a 6-passenger van, for instance, don't put 6, put 4. You need to look at the spacing so that you can keep some social distance between them. Depending on the weather, can the windows be down so you have good ventilation? And then everyone needs to wear a face mask if you're going to do groups. I'm not saying don't do it. I'm saying if that's necessary, then please take the appropriate precautions.
Okay, thank you.
Great question, thank you for that.
All right. Anything else? Okay,
Look-
well, I really appreciate everyone's questions and your interest. I think we all share the same goal, keeping everyone safe while they're doing the point in time count, the homeless outreach. And certainly, we want people to feel comfortable when you're interviewing them, because this is very important and it's going to influence resources available for the services that people need. So thank you very much. My contact information is on the slide. You can email me if you think of other follow-up questions.
Thank you very much, Barbara. We appreciate your time.
Yes, thank you,
You're very
Barbara.
welcome. Everyone have a good afternoon.
Oh, we had, sorry, Jace. Someone
Oh, one
raised
more?
their hand and we lost them, so
Oh, all right. I'm signing off.
brought it back down.
All right.
Thanks again, Barbara. So this definitely is a COVID-19 is definitely something that's going to be on our mind during our planning of the point in time count. I wanted to see, next slide, Monique, I wanted to see if we have any additional feedback from some of our partners regarding our approach regarding COVID-19. It sounds like Barbara has given us really good feedback that we can definitely implement as we recruit community volunteers. I've said it before that we will let volunteers know that if anything changes in terms of COVID, if there's a spike or if there's anything that would make us hesitate to use community volunteers, that we would make that decision. And so we wanted to just we want to make sure that volunteers know that at some point it could be canceled. The volunteer participation could be canceled, not the point in time count. But just so that when they are coming into this effort, that they know that ahead of time. Let's hope that that's not the case, and we are able to implement these safety precautions that Barbara shared with us. Do we have any feedback from any of our supervisorial district offices regarding COVID-19 and the point in time count? What about state leaders? I know a couple of you asked questions. Anybody has any feedback? Law enforcement, any additional thoughts? We do have our continuum of care members who we always welcome to our meetings. Does anyone have any additional feedback or concerns about our approach to working with community volunteers? Board of Governance? Anybody from our county departments? I know I did see some comments there that, for example, the school districts are already requiring employees to provide proof of vaccination. So any feedback that you all could provide. Margarita says nothing from Lake Elsinore side. Thank you. Okay, I just wanted to give people that opportunity to provide feedback. The information that Barbara sent or shared with us is going to be very helpful. Okay, next slide. Thank you so much. Oh, sorry. Margarita said it's not Lake Elsinore, it's law enforcement. Thank you for that clarification. Okay, so we're going to go ahead and move forward with our meeting. Next slide, please. We all are here because of the homeless point in time count. It's a snapshot. And once again, we really need to remember we only have that 4-hour time frame to count as many individuals as we can. So we have to use our time wisely. We are promoting the more than a count for the 2022 homeless point in time count. What does that mean? that we want to always increase community involvement to facilitate an accurate count. That's why you were all joining us today. You are the experts in your neighborhoods and in your communities, and any feedback that you provide is always welcomed. We want to also look at the possibility of providing referrals to those individuals that we do encounter on the day of the count. We have an initiative that we are going to be developing, a new initiative that basically provides linkages to anyone that we encounter on the day of the count. In the past, our focus was completing the surveys and then we would move on. Feedback has always been that if we are engaging those individuals at that time, maybe we can find a way to also provide them with linkages and referrals. So once again, we are hoping to plan something around that thought for the 2022 count. We want to also take advantage of our street outreach teams. We have several outreach teams that are working in the community, and they have a lot of knowledge, and we are definitely going to be working with them to hopefully plan a successful count. And then finally, with our youth, homeless youth, same thought, connecting them to resources as we engage them, just to make sure that we are not only counting them, but we are also connecting them to services that they may need. So that is kind of our More Than a Count initiative for 2022. Next slide, please, Monique. Just wanted to share some of the important components of the homeless point in time count. Yes, we do the general street-based count on Wednesday, January 26th from 5:30 to 9:30, but we also conduct the service-based count, the unincorporated non-city area count, and then, of course, the very important dedicated youth count, 3-day count. We have our homeless youth coordinator here today, AJ Vasquez, who's going to be sharing some information with us about planning for the youth count. And then the Come and Be Connected events. As some of you may recall, we were referring to these events as Come and Be Counted. We got some feedback regarding that title and wanted to just make sure that youth know that it's for services and it's to make sure that they're connected with the proper agencies. And so we thought we would alter the name a little bit and call it the Come and Be Connected events for youth. And so AJ is going to share with that, share a little bit about that with us later on in this presentation. Next slide, please, Monique. I wanted to update you a bit about the point in time count methodology guide. HUD releases that every year. It includes all of the questions that need to be included in the survey, all of the data we are required as a COC to collect. We are still waiting for that guide to be released. They say anytime now. And so the first step as we develop the methodology for the count is to make sure that we are following all of HUD guidance and that we are using the appropriate methodology for both the sheltered and the unsheltered count. And so once we receive that guide, we will review it, make sure that all of the questions that are that need to be in there in the survey that we use are included. And then we can finalize the methodology that we will be using for the count in 2022. As some of you may recall, HUD requires the homeless count from the continuum of cares throughout the nation. And so we will be submitting for approval our methodology for the 2022 count to the COC soon, as soon as we once again get that guide. So we'll share that guide with you as soon as we get it, if you have some time to review it. It's got a lot of guidance in there, like I said, and best practices about how to conduct the count. Next slide. Wanted to provide some updates about some of the tasks we've already started working on. One of them, of course, is the very important kind of glue that holds our count together, which is participation from our city leaders. And so we have been working with all 28 cities in Riverside County to obtain or identify the city leader for each city. And we are doing great. We've identified 25 city leaders who are communicating with us and getting ready to implement the count in January, end of January. So we are moving forward with that. And once again, the reason why we want to work with city leaders is they know their communities better than us. They know where individuals living in the streets are located or are congregating, and so they are the best or the most appropriate individuals to plan the count in their cities. And so we have a lot of them here today, and we really appreciate their time and effort in planning this count. Volunteer recruitment plan. We have a lot of things happening right now when it comes to recruiting volunteers. We have the county's community and government solutions team that has just joined us within the last couple of weeks, and they're going to be taking on this task of recommending a lot of ways we can recruit volunteers. One of the tools that they provide us is a press toolkit for all of our city leaders. That includes the community volunteer recruitment flyers, and a lot of posts for media platforms like Twitter and Facebook. The feedback we had gotten from our previous leaders is that they didn't really have time to create this media tools. They just wanted to be able to use something and put it onto their city's website or tweet it out. And so this team is going to be providing these posts already ready to go. And we're going to share that with all of the city leaders so that they can use that to recruit volunteers in their communities. We will also provide a PowerPoint slide. We know that a lot of our city leaders are trying to get their city leaders and community involved and motivated to participate in the count. So a PowerPoint sometimes helps where they can just kind of use that as their template to present at city council meetings or any other important meetings where they would want to get involvement from their city individuals. And then also media relations, that's a big, it's about bringing awareness about homelessness to Riverside County end of January. They have a lot of activities planned in terms of making presentations about the count, but also working with media to set up some areas where on the day of the count, they can be there to meet the media and coordinate that important piece. So we're very glad that they're involved in once again helping us promote this count. Next slide, please, Monique. We are also working on creating social media specifically for the homeless point in time count. Once again, to promote it and to really spread awareness to the county. I still encounter a lot of people in the community that have never heard of a homeless point in time count. And so we want to change that. We want to make sure that we bring awareness and that our communities know what we're working on and the purpose and the reason why we're doing this. Two new items that we've added this year is that we are in the process of developing an actual homeless point in time count website. It is new. We have not used it in the past. And it's a very useful tool for people to go into this website and find out about the homeless point in time count, but also how they can volunteer if they're interested in volunteering. So we are going to have a general count website, and then it's going to have a link to the youth count website as well. So we're very excited. Just once again is creating a way to present the homeless point in time count to our community members, where they can go and they can learn more about what our efforts are about. Our volunteer registration portal, we got a lot of feedback from previous counts, volunteers, where they said that, you know, they wanted more communication from us. That does take a lot of effort. And so we are working to use software where once the volunteer registers, we can send automated emails to them, keep them informed, and keep them up to date on the most current information about what is happening with the count. So this would be what we would use in the event that we would have to cancel volunteer participation. We would be able to use this tool to be able to communicate with them. Our goal is to allow access for city leaders to be able to go and look at their volunteer lists in real time, so they have a good idea of how many people have been assigned to their city, and if anyone registers but they are sick because they're not going to be able to make it, or they had a change of plans, then once that volunteer checks in and says I can't participate in the count, then the city leader would have a current list of volunteers assigned to their city. So once again, it's just our effort to maintain communication not only with volunteers, but also with our city leaders that are going to be so busy doing so many things as they prepare for the point in time count. A question: is this the same portal that that city staff are going to be registering in? Yes. Our ask is that anyone that participates in the count register as a volunteer. We'll give you more details as we continue planning, but HUD actually did an audit on our program, I would say last year or the year before, and they really asked for a lot of information about our volunteers for the point in time count. Remember that they want as much consistency across the board when it comes to volunteers, how they're trained, and what they're told to, how they use the survey. And so we had to provide a lot of information to them to confirm that we did use community volunteers, tell them about the type of volunteers that we had. Were they city staff? Were they community volunteers? Were they county staff? Were they service providers? And so we want to make sure that we collect all this information. And so one of our asks is that if you are city staff, if you don't plan to use community volunteers, but you will have city staff participating, that they register as well as a volunteer. Hello, Jean, do you have a question? Oh, I saw your hand go up and I saw it go down, so maybe.
Yeah, I was just going to throw it in the chat, but we were wondering if you're going to have a hotline. I know that previously you all had a phone number where people could call if they had questions, and I didn't know if that was continuing.
Thank you, Jean. Yes, we will have a hotline. We will have that number on the website, the point in time count website, and on the flyers as well. It's just another way that volunteers can reach out to us.
Okay, and is that the same number we've previously used, or has that changed?
It's the same number.
Okay, thanks.
And I see a lot of questions coming up, and I think I'm going to answer them in the next slide. So next slide, please. Or not this slide, but the next slide. Okay, the survey tool. Someone asked a question about the survey tool. Once again, we are waiting to finalize our survey tool until we get guidance, that methodology guide from HUD. So as soon as we are able to confirm that all the questions are in our survey that should be based on HUD recommendation, or not recommendations, requirements, then we will finalize the survey. However, I know some of you, most of you, I hope, received an email reminding you of today's meeting, and it included the survey that we used in 2020. because we wanted to give you an opportunity to kind of review that survey and provide feedback. So we will have a work group today focusing on the survey, once again, obtaining that feedback from all of you. We want to make sure that we're meeting the requirements from HUD, but if there are any questions locally that we should include in the survey, then I think it's important to discuss. I always use the example in 2020, we added a pet question. It's not a requirement from HUD, but some of our partners wanted to learn a little bit about companion animals and the homeless population, and when they are offered shelter, if being able to bring their pets makes a difference in them accepting. And so during the community planning meetings, we were able to discuss that and add that question. Another example is the couch surfing question for youth. HUD does not require couch surfing to be a question. Once again, our community felt that it was an important question as we learn more about the homeless youth population. And so we did add that to our survey. We don't report that information to HUD. We only report information that they require from us, but we do have it and we use it for planning purposes and strategies. So I'll talk about the timeline in a second and answer that question about when it will be ready. Quick update about incentives. As some of you may recall, when we interview individuals, we do provide them with an incentive bag. Our goal for the 2022 count is to prepare 1,500 incentive bags that are going to be distributed to the deployment sites and that volunteers will be able to take out with them as they canvass their communities. We are going to be able to purchase by the county a lot of these incentive items, the primary incentive items, which are the socks, the bags, the beanies, and the gloves. But we are also conducting an effort to obtain donations of additional items that we would like to include in the bags. And then the youth count also has their own initiative of trying to obtain donations for the youth incentive bags as well. They'll talk a little bit more about this later. And so we will definitely have to come up with the distribution plan of the incentive bags once they're ready. We are hoping to get volunteers to put these bags together as the count approaches. Next slide, please. In terms of the specialty counts, I wanted to provide an update on these two important counts, which is the service-based count. That is our effort to interview individuals that we may have missed during the street-based count. And we are working right now to identify service providers. So our efforts right now are just making sure that we have as many service providers agree to participate. And basically it's just at their agencies, if they have someone that comes in and may be homeless, to be able to interview them there if they were missed during the street-based count. Same thing for the unincorporated area count. We actually are identifying some lead agencies. It's generally our partners with the Sheriff's Department because the unincorporated areas are a little bit harder and trickier to access. We tend to work more with our homeless outreach teams and our behavioral health teams to plan that count. So we will be planning a meeting at the end of November to bring together some of these agencies like code enforcement and any other agency that would help with this effort. But we will make sure to let everybody know that the meeting is going to happen in case you are interested in attending and learning more about the unincorporated area count. Next slide, please. So here's our tentative dates and timeline for upcoming activities. So our goal is to have our volunteer recruitment flyers ready to go by the end of this week. Our team is working on that, making sure that the volunteer link is on there, the hotline, the Homeless Point in Time Count hotline number is on there, and an email where people can send questions. And so our goal is to have both of these flyers ready by the end of this week. That means that our volunteer registration would open November 19th, end of this week. So we're very close to opening up volunteer registration. But once again, we have to make sure everything is in place and we have that HUD guidance in our hand, and we make sure that we cross everything off that is in that guide before we make that final decision to start volunteer recruitment. We will have a youth incentive drive, as I mentioned before. It's coming up next week. We're going to have one of our Youth Action Board members or coordinator talk a little bit about that with you today. Let's see, we will be submitting our final recommendation for the 2022 homeless count methodology to our COC partners. As required by HUD, it needs to be approved by them. So we want to just make sure that they know how we are planning this count, and that they are able to also provide feedback. And I know we have a lot of partners from our COC partners here today, so it's always good to have them participate in this planning effort. We also, let's see, we want to finalize that survey tool. Hopefully, once again, the 20th of this, yes, the 20th of this, I'm sorry, I'm having a hard time seeing this finalized. The tool, December 20th, if not before. Once again, we want to get feedback. We want to get that survey ready to go, because that survey is what we will be using to train our volunteers. And then we want to secure incentives in December. We want to conduct a volunteer online training in January. We want to wait until January to conduct the volunteer training, because we don't want to give this volunteer training too early, and then people are going to forget, or many things can happen. So we will be working on designing the volunteer training that will include a lot of pieces of what Barbara brought up today, letting volunteers know if 2 days before the count or a day before the count you are ill for whatever reason, please don't show up to count and to volunteer. So we will be working on that training. So we will have kind of a live volunteer training like we're having right now. We will record that training, and then we will post it in the volunteer registration portal. So only registered volunteers are going to be able to access it. They will view the training, and then they will be asked a couple of questions to confirm that they saw the entire training, and then that will give us confirmation that they participated in a volunteer training. They will have access to it up until the day of the count, so they can revisit it and view it as many times as they want. Once again, just to make sure that we are in compliance with HUD, that all of our volunteers received a training. We have 2 more community planning meetings, one in December 15th. And so we will meet again. By then we will have a lot of our tasks checked off. Hopefully, we will be actively recruiting volunteers. We will be working towards finalizing our survey. And so please join us for that meeting. Let's see, an important date will be volunteer recruitment will close on January 18th. We need a couple of days to sort through our volunteers, see where we need more support, where we are okay. And so we want to close off volunteer recruitment on the 18th. And then, of course, January 26th through February 2nd, we will conduct the point in time count. Who can tell me why it goes all the way to February 2nd? Does anyone know? Not a typo. Just remember that there's a lot of different components to the count. The general count is a 1 day, count. But we also have that unincorporated area count, and that's 7 days post. So that brings us to February 2nd. Someone just asked the question, how long will the volunteer training be? I wish I could say it'd be 3 hours, because we really want to make sure that volunteers get a proper training, but we also recognize that 3 hours is too long. So I'm thinking that just making sure that we cover all of the important pieces, which is safety, how to use the survey, that we sometimes get a lot of new individuals that have never used a survey before. So we want to make sure that they receive enough instruction. And also we want to make sure that they understand the importance of following, the COVID safety precautions, but also what they should do, what they couldn't, what they can't do when they're engaging individuals in the street. So there's a lot of information to cover. So I would say that our goal is going to be an hour training, and we may add a couple of additional videos, but the training will be an hour. Any questions about updates and the timeline for the count? No. Okay, next slide, please. Okay, so we've gotten to the portion of our meeting that we will break out into some work groups. And we have already worked on assigning individuals to the work groups. I hope that we picked the right one for you. But we will have a work group that's going to focus on the survey tool. Once again, we want to make sure that we obtain your feedback about questions. We actually already received 2 suggestions for the survey tool. And this group is going to discuss that a little bit for about 30 minutes. We will also have a very important work group, which is that housing and services linkages activities that I mentioned. It's part of the More Than a Count initiative. We want to, once again, get your feedback. It is a brand new initiative that we're working on. And so the more feedback that we get from our partners about what that would look like, the better, because when we sit down and we start thinking about, okay, this is what we want to do, how can we do that? It can be very challenging. So we have divided also some of you into the youth count work group, and so we will go ahead and send you off to your groups. Anybody that is management, that is a city leader, will stay with me. And then everybody else will be sent to a work group to work for 30 minutes, and then we will come back. So hopefully everything works as we planned, and then we're going to go ahead and send you to your work groups. Here. Okay, great questions. Rain or snow, is this count going to happen? Yes, the answer is yes. Good. Okay, next slide, please, Monique. Yes, the feedback that we have received from HUD is that because Riverside County submitted an exception request for the 2021 count that they are going to want to see the count. And so what it looks like, we're hoping that what we are planning will continue. If COVID, I would say that the only change would be as a result of COVID, where we would not use community volunteers. But other than that, we would move forward with a count. I don't see HUD allowing us to skip another year of the homeless point in time count. Next slide, please. Okay, so it looks like I have about 55 individuals in this group. And this is city leader information. So as I mentioned, the way that we approach the homeless point in time count in Riverside County is that we divide it by cities. 28 cities, each city has a leader, and we work with them to implement the count in their own city. And so I continue to receive a lot of your information about how you plan to implement the count. And we are here to support and help you. And I wanted to talk a little bit about the differences or the different approaches some of the cities are taking. Let's see, hold on. Can I hear you? What I'm seeing? Oh, okay. Someone sent a message. Jonathan, can you check? I think someone's stuck in the middle. She can see us, but she can, anyways. So some of the cities, they decide to have a city leader be kind of their representative, but they also have law enforcement that provides that additional support. And so that would be one type of approach. Other cities have law enforcement, are law enforcement led only. So they opt out of providing a city leader, and they have law enforcement take over the whole coordination of the count. And so it's just a different approach, and it's fine. However, we find that when it's law enforcement led only, our law enforcement partners need a little bit more support in the area of coordination, because their focus really is safety and making sure that the city is covered and people canvass the community based on where people are congregating. And so what we do is that we will be providing a coordinator to law enforcement led only cities, just to make sure that on the day of the count, when volunteers show up, someone will be there coordinating that piece on behalf of that city, and law enforcement can focus on the safety piece. So I know I've had a couple of law enforcement partners say, you know, I don't know how to recruit volunteers, or I don't know what to do. And our response is we will make sure that we recruit volunteers. Of course, we are going to be recruiting volunteers across the county, and we will be assigning them to the cities. And so how does that work? Once I have identified the city representative for a specific city, let's just say Riverside County, I ask for their information, who's going to be their law enforcement lead, just to keep everyone informed. But then I also ask them, how many volunteers are you going to need? Some cities decide that they want to only use city staff. Once again, that's okay. And that they don't need any community volunteers at all. And so that helps me, so that when volunteers are registering and they're putting in their name and information, and we ask them, where do you want to volunteer, that I will know that I don't need to assign anyone to the city of Riverside, because they've told me that they don't need volunteers, which is not the case, because Riverside uses a lot of our community volunteers. So we're going to be assigning a lot of volunteers to their locations. So We assign the volunteers using that information. So as city leaders, I really need you to get that information to me. If you don't know, please just email me and we can work on it together. I can look at our 2020 numbers to see how many volunteers you used in that year, and then we could come up with a number. And so community volunteers are there if you need them, but if you feel like we don't need community volunteers, that's okay. As well. But remember, even though you're only going to use city volunteers, you need to make sure that you ask them to register. Using the portal, it'll be easy. They go in, they put their name. If they are city staff for the city of Hemet, they will say, I want to go to Hemet, and then Hemet, the city will say city staff only. So volunteers will know that if they're not city staff, that they're not going to be registering. So that's important information for me to have from all of you. Once again, sometimes you're not sure yet. It's still early on. So a lot of you are already responding to that information. But if you're not sure, please just email me and let me know. I think we've come up with a really good system where I'm getting really good questions from our city leaders. And then what I do is I usually will reply, but then I'll formulate another email to all of the city leaders, because I think if someone has that question, maybe someone else does too. And so once again, it's really important that city leaders encourage their staff to register as volunteers, because that is the only way that they're going to be able to use the survey app. We are using Survey 123 on our phone. We are going to be downloading the app. We're going to be downloading the survey once it's ready. And it's going to ask every volunteer, what is your first initial and last name? And they have to put it into the survey before they start conducting a survey. Why are we doing that? We want to make sure that the right people that should be surveying are surveying. Unfortunately, anyone can, if they really want to, they can access the survey, the Riverside County survey, and they could complete surveys by not interviewing someone for whatever reason they might have. And so if we are able to ask the volunteer who was registered and who was participated in the volunteer training, then that gives us a little bit more of security, knowing, yeah, this is a volunteer that registered and they also were trained. At the end of the homeless point in time count, we do pull the data that was collected and we do run deduplication on all of that data using 10 variables to make sure that we didn't survey someone twice, but we also look at data that doesn't make sense. So for example, if someone conducts the Riverside County survey and it's pinged in San Bernardino, we're not going to use that survey, because Esri's telling us that survey was, the person conducting that survey was actually in San Bernardino when they did it. So we would pull that information. We've seen in the past a volunteer that submits 15 surveys within 10 minutes. And so that just doesn't make sense. So we are forced to pull that information as well. So once again, that is the reason why it's so important to have all volunteers, all city staff, anyone that participates in the count register, so that we could recognize their information when we are looking at the data. I mentioned the HHPWS coordinators. We will be assigning someone to every deployment site to provide support. We know that a lot of the cities are really well organized and they have it together. If you feel like you don't need extra support in the form of a coordinator, just let me know. But once again, it's our ways to making sure that you have the support that you need on the day of the count. Give me a second. We're trying to assign individuals that are lost. And so if you wouldn't mind giving me a second, I'll. Oh, there you go. Okay, thank you. Let's see. Oh, sorry. Do you want me to print it? Sorry. Want to make sure that all our partners are in the right group. Any questions so far? I know it's a lot of information for our city leaders and law enforcement led cities. That's okay. No? Okay. Volunteer registration portal, like I mentioned, it's almost ready. We've already put, questions for volunteers. For example, are you bilingual? We will be putting a question that says, I am fully vaccinated, or I can provide proof of a COVID test 72 hours before the count. And so right now we're actually pilot testing it, shared it with our staff. They're completing it, they're registering so that they can kind of catch any errors that we may have missed. But once again, our goal is to finish this by the end of this week so that the volunteer registration link can go live at the end of this week. Once again, we will provide all of our city leaders with access so that you can look at your list of volunteers and even email them if you wish. And it will be in one location. You don't have to worry about lists or not knowing if someone is no longer going to be attending because they're sick, because you'll have that information. So that's a very exciting new component of our count. City maps. We in the past have been able to, our RCIT department has been able to print out city maps to all of our city leaders so that they could take a look at their city's area, their geography, and then divide that city into sections, and that's how they create their teams. And so I am going to be following up with all of you city leaders to let me know if you need that assistance on our end. A lot of city planning departments may be able to help, and they have better information that is more relevant to your city. And so if you would like to use your city planning department mapping software, and you really don't need a map from us, that's okay as well. And once again, I will send it in the form of a question. Will you be needing maps from us? And then we can work on those with those cities that do need maps, and then we will be okay with those cities that are creating their own maps. Any questions? No? Okay, so I wanted to talk a little bit about creating volunteer teams. I know I have some seasoned leaders on this call, and I wanted to see if any of you have any kind of tips that they can provide to new leaders as they start thinking about creating volunteer teams. Kind of like, what do you look for? Any feedback that you think would be helpful. So I'm going to go to show participants and see if I can ask someone to join, to share your wisdom with other leaders that may not have so much experience creating teams. Let's see.
More.
Oh, there's more. Mm-hmm. Oh, see more. Okay, I knew there was more people here. Anybody that would like to share kind of how they create their teams on the day of the count? I think that would be really useful to some of our partners. Let's see. Let's see. I see Jay is on here from Palm Springs. Jay, I know you've done the count many years along with Dale Cook.
Wrong Jay.
Oh, really? Let's see.
Hey, Laura, I'm happy to chime in too.
Sure, go ahead. There you are.
Yeah, actually, Dale was the one who kind of led the effort and how we have done it. But the last 2 years we haven't done it. And the prior years, we did have good help from the county to help us out. But essentially, we had maps of all the areas in the city we wanted to send teams out to. So we have kind of had control in terms of where the volunteers were being sent. And when we got together in the mornings to organize, we distributed the maps. We had everybody form the teams they wanted to be on and distributed the maps to those teams. And they would go out and do the counts at those locations. Some had more contact with individuals than others. And, we were also handing out those goodie bags. And so sometimes we had to run back to our meeting place, our initial meeting place, to pick up more goodie bags and go back. But it basically went that way. Then everybody, when they were done, just checked back into City Hall, which was where we had launched from. So, we have a lot of volunteers in the Palm Springs area too. So, there's working with that it's a good thing, but it can also be a challenge.
Thank you, Jay. I appreciate for humoring me. But you bring up a couple of really important points, that working with volunteers, especially with the bigger cities, you have to, because you need so many, you need a lot of people. And so that's why we do our best to make sure that the volunteers we send are well trained. And that's why, it's so important to have that training for all volunteers. And managing the volunteers can also be difficult. I know on the day of the count, if Palm Springs said we need 70 volunteers and we assign 75, and unfortunately there's a couple of no-shows, then they're short volunteers and they have to make that adjustment on the day of the count. And so I always try and pad it. If you tell me I'm going to need 70, I'll say 80, just because it's best to pad it a little bit, because we know that we might have some no-shows. People do call us and tell us, I'm not going to be able to make it anymore. I am sick, or I'm not available anymore. And so we try and communicate that to our city leaders, but ultimately it's the day of the count where we definitely want to make sure that you have the support that you need in terms of the volunteers. Team wise, generally the deployment site leader is the one that kind of says, I have this area, I have this map, I'm going to divide it into sections, and I'm going to assign 5 teams. Generally 5 teams means that there's going to be one person that has at least participated in a count previously. So our goal is to make sure that your team has an experienced person. You can have new volunteers that have never conducted a count before, but at least one person where they have that familiarity with a count previously. We will have also encourage law enforcement to be part of a team as well. They provide the guidance, they provide the safety right before the teams go out into the community. They might even do a quick safety reminder. It's never a bad idea to just remind them once again to stay in pairs. And we get a lot of feedback from volunteers. And the first question that I think I always get is, am I going to go out by myself? And so we always like to reassure them that it's they're going to go out in teams. You can have a couple of volunteers that are going to be actually conducting the survey. You can have a person that's a driver that's going to drive individuals to the location, and based on Barbara's feedback, I think that cities are going to have to decide whether they're, you know, how many cars are going to be driving out to the location that they have been assigned to. We always encourage team members to check in and check out. So don't go home after, come back. And if, you know, in the past, they were driving together, so people couldn't leave. They would have to get back in the car and come back to the deployment site. Now that we might use a couple more vehicles to spread it out a little bit, spread out the volunteers, I hope that people won't say, well, I'll just go home from here, because once again, their safety is so important. But we do cover that in the volunteer training. Just in terms of the volunteers, if you are going to be hosting volunteers, we do encourage you, if you have the ability, to provide a light snack or coffee for volunteers when they come in as your setup. It's not required, but most of the time, people are going to volunteer in the cities where they live, right? That makes sense. So you're going to be helping promote our volunteer recruitment effort. So most of the people that are going to come to your site, if you use volunteers, is going to be people from your community. And so if that's something that you're able to do, that would be great. Some cities are already telling me that they are going to be providing a light breakfast for all of their volunteers, because it's a small group. Of course, you know, Riverside, they have, you know, 70 people coming in. Yeah, that's an effort right there. So those are things that you know, as city leaders, you can plan. Same for the incentives. We will provide you with the incentive bags that have the minimum items. If you would like to add, as a city, if you would like to add anything to that incentive bag, we will do our best to get it to you in a timely manner, so you have time to have people stuff your goodie bags with additional resources from your city, with water or snacks, things like that. So those are, once again, things that you can kind of think about as we get closer to the count. Any questions? No questions? Oh, there was one in the chat. Okay, thank you. Let's see. I think there was a question in the chat. Let's see. Oh, it's a long one. Okay. Oh, okay. So Emma had a suggestion about a question for the survey. We will be pulling those questions and we will be presenting them to our community planning team, so that as a group we can determine what would be, you know, the best use of, once again, this survey, which is to collect the, you know, the minimum requirement is to collect the data that HUD is asking us to collect. And so we will definitely have that list of those questions that were recommended by our community partners. You know, I'm sure all of us could think of at least 5 additional questions to add to the survey. You know, and it's tough because we want to keep the length of that survey as short as possible, because we don't want to run the risk of having people say this is too long. And if any of you have ever been surveyed, we've all been in that same position when someone says it's 10 minutes and then the questions keep coming and coming. So yeah, we want to be mindful of that. But also now with the COVID, the 6 feet apart recommendation that Barbara said, right now our survey takes about less than 10 minutes, I think maximum 10. But if we make it longer, we may, you know, start worrying about exposure to someone because the survey was, you know, more than 10 minutes. So once again, these are questions that we, things that we need to consider. Toya, you have your hand up.
Oh, yes. Thank you, Laura. Yeah, this is a big concern in my work as well. I know that the application is extensive, but it is very important in the work that I do that the formerly incarcerated people that are homeless are actually accurately counted within this survey, so it can be, you know, in your data. So when they go to reach for it and search for it, they can see that it really causing the effect in our community in this area. And I think it's not really being addressed in the manner that it should be addressed. And it will also aid in removing housing barriers when it comes to that, because people will be able to get to see the need of people who are returning home. You know, they're having difficulties, minors trying to come back home, and then HUD, Housing Authority, has these policies and things in place that contributes to homelessness. So if they can see this data in this point in time count, it really would add up. So I really appreciate you giving me the opportunity. Thank you, Laura.
Thank you for your comment. And I know that I did receive that recommendation for the question, and I did pass it on to the work group that's looking at the survey right now, focusing on, I know that there are some questions already about formerly incarcerated individuals, but the question is, have you face barriers in accessing housing as a result of your conviction record or the conviction record of a family member? So we did receive that recommendation. So we will definitely bring it up to the group. Thank you for bringing that up.
And thank you so much. Thank you so much, Laura. I am a prior participant of Point in Time for the youth and adults. So this is amazing to see you guys here still doing the work. Thanks.
Thank you. Thank you so much. And I'm glad, you know, it's always good to see new faces, but it's for me, it makes my job easier a lot of times to work with individuals that have participated in the past with the point in time count, because they're familiar, they understand the importance of it. And so thank you for coming back to help us.
You're welcome. Thank you so much.
Okay, let's see, did I see another hand? I think that was the same hand that was up. Any other questions from city leaders? I will continue if I continue to receive, if I receive questions from our city leaders that I think would be good to share with other city leaders, I will send out an email and say, this is a question that came up, and maybe put some details behind that. I hope that serves the purpose of just keeping all of you informed and prepared for the count. As my great leader, Tanya Turner, always says, you are not in this alone. So none of you are in it alone. We're in this together. My role is to make sure that I keep you informed, and that we ensure that we are following HUD recommendations and guidelines. But other than that, we're here to help each other. So please email me whenever you have any questions regarding your participation as leads in the point in time count. Next slide, Monique. So I kind of covered a couple of areas that I think are important, but I wanted to hear from you. If you are kind of sitting there going, I wonder how this happens, or I wonder how they do this. I just wanted to kind of leave it open, like an open-ended invitation for you to say, how do you guys do this, or how is the this component implemented? So think about that. Any questions you might have about how we implement the count on the day of the count. We arrive to the deployment sites. Every city has a deployment site. So if you have not provided me with your deployment site, please do so. We still have a little bit of time because we will not be assigning volunteers until probably early January. We'll start looking at assigning volunteers. But please let me know if you have any questions. And let's see, we will be having a drop-off point from veterans so they can be screened and referred to programs. Okay, so Pedro's asking the question. That is part, in the past, we focused on providing services to anyone that identified as a veteran. It was our veteran assistance plan. And so volunteers, when they were interviewing someone and they said, "Are you a veteran?" and that person said, "Yes, I am." They would ask them, "Do you want to be, do you want to get off the streets?" And if that person said yes, we actually had a plan on the day of the count, that 5:30 to 9:30 timeframe, where we would request that they be picked up and taken to what we refer to an assessment center, where staff would begin to determine eligibility. That is that part is now being put into our More Than a Count initiative, the Housing and Linkages initiative. And so that work group is gonna begin to develop a plan about how to do that on the day of the count. There will be some individuals, for example, I'm gonna always use this example because it was horrible, but we had a veteran who was out in the streets in 2020 with his 80-year-old mom. And so he was interviewed. And so those vulnerable populations, those individuals, we will do our best to coordinate efforts so that we not only can pick them up, but determine if there's a bed available for them. That work group is going to be coming up with kind of an inventory of available beds for that day of the count. And if that person is a good fit for an available bed, then we would work to connect them to that agency that's providing services. However, if we are not able to pick them up, we are working to work with our homeless outreach teams to conduct follow-ups with anyone that we encounter on the day of the count. And so we will not just interview them and move on, but we will ask them, "Do you want someone to follow up with you?" If that person says yes, we will then proceed to collect their information and then work with our homeless outreach teams to share that information with them so that they can follow up with anyone that would like to receive services. So that is part of our housing and services linkages initiative that we are developing from scratch this year, and I'm sure that work group is going to be very successful in coming up with a plan.
Is there a way to get put into that work group? I'm sorry, I didn't even introduce myself. I'm the outreach coordinator for US Vets Inland Empire. So I'm new to US Vets Inland Empire, but I've been with US Vets for 7 years as an outreach coordinator in Long Beach. So I'm not new to a point in time count, but I would like to do maybe some kind of drop-off point or something here at Marshall Reserve Base where we can screen veterans and get them in a place and possibly even be able to drive and pick them up. So if I can be invited to that group, if that's possible.
It is absolutely possible, Pedro. We welcome your participation. We actually will be talking to that work group today about setting up an additional meeting outside of these community planning meetings because it's so much work that has to be done. We don't want to wait until the next meeting. And so we're working on identifying our partners, and you just self-identified. And so I will make sure to add you to the housing and services linkages work group. We will let all of you know when that meeting is going to happen. If you're interested in attending, you're welcome. You don't have to, but it's a lot of information. So yes, I have your name, and I will make sure to get you that information, Pedro.
Thank you.
Any other question? Are we almost coming back? Can we pull everyone back here?
Yeah, you want to pull everyone?
Yeah, I think because of the interest of time, we're going to have to pull everyone back from all their fun stuff that they're doing in their work groups. So we will pull everyone back and wrap up our meeting. So we'll wait for them. Monique, can you move it? Can you move the next slide, please? No.
Laura.
Yes.
While we're waiting real quick, I know you were just explaining to the other Pedro a minute ago. Will you have services for individuals that we identify that we could be having a mental health crisis or suffering from HIV or AIDS or anything like that? Will they have services to come pick them up and stuff?
You know what? I think the work group is going to have to determine that. We don't want to overextend our commitment to saying, yeah, we'll pick up everyone, unfortunately. And so the work group is really going to come up with a good plan where if we are not able to provide services to individuals at that moment, that we would be able to do follow-up. And so our concern is that if it was up to us, we would pick up everyone, right? But in 2022, we counted 2,100 individuals out in the streets, 2,155. And so because of limited resources, once again, we don't want to make a commitment that we cannot follow through with. But if you are interested in kind of what that plan looks like, once again, we're going to make sure that we invite you to that work group meeting.
Awesome. Thank you so much, Laura.
Hello, everybody. I went ahead and I called everyone back because I know we're a little bit short in time, and I appreciate all of you for staying around a little bit longer while we do a quick summary. Ideally, I think we always want to highlight the youth point in time count. And so I will go ahead and if AJ is back, give him a couple of minutes to do a quick summary of what the group discussed and tell us kind of what the next steps are for youth point in time count. By the way, AJ is the youth coordinator this year, and we are so happy that he is on board. He has such knowledge about youth and their experience in homelessness, and he is from Operation Safe House. They are always so supportive of the youth point in time count. So in a brief couple of minutes, AJ, if you don't mind just giving us a quick update on what you've been working on with the youth count.
Yeah, sure thing. Thank you so much, Laura, for that introduction. For those that don't know me, my name is AJ Vasquez. I'm the Youth Point Time Count Coordinator, but also a field manager for Operation Safe House for the outreach team. And in my group for the youth count, we were discussing what primarily the Come and Be Connected events. So if you have experience with youth homelessness or working with clients that are homeless that are in the Tate range, you can see that they're called the hidden population for a reason. They tend to hide. They don't want to be outed as being homeless. They want to be stigmatized. We can all remember back to our high school days. If you get labeled as something, it's hard to shake that label, right? So again, with these youth, they try to blend in as much as possible. So what we're really trying to promote this year are these Come and Be Connected events. So in keeping with the theme of more than just a count, these events are resource oriented. And we're hoping to do is spread the word about these events so that way homeless youth that are in need will come to these events and not only get resources, but also participate in the count. So it's one way of being able to count these youth by enticing them to come to one location so that way we can get them counted. Because like I said, in years past, the homeless youth count in generally has been undercounted. The reason being, as like I said, it's very difficult to identify homeless youth. That's why it's done over 3 days, as opposed to the adult count that's done on 1 day. A client could be at, Reed Park, Riverside on Wednesday, but not on Friday or Thursday, and maybe not even at certain times every single time. They tend to move around a lot. So with these events, what we're discussing is ideas for different organizations or resources to attend. So that way, again, we can connect these youth with as many resources as possible. Some ideas were, Come Back Kids, so that way they can get connected with to get connected with an organization that can help them out with their schooling, finish up, contact the homeless liaisons to assist with, McKinney-Vento laws, being able to re-register them back in school, get them assistance with getting their documents like birth certificate, driver's license, ID cards. Another idea was reaching out to these companies that give out free phones. That would be a great idea, or a great way to be able to entice youth to come. And that was an excellent idea. Because like I said, what youth can't, go without a phone, or who actually, I shouldn't say youth, who in general can't go without a phone nowadays, So these are all just different ways to help entice youth to come out of the woodwork, so to speak, and come to us and be counted. So that's mainly what we were discussing in our group. Like I said, we got some really good feedback, really great ideas, and I'm excited to start working on those. We do a street-based count. I am recruiting experienced street outreach workers to serve as team leaders, to be able to go onto the field and lead and work with the volunteers and make sure, just for overall safety, for this group of individuals, it's safe to approach. Or if it's a circumstance where it might be a little too sketchy, and say, let's not approach this group for safety concerns or whatnot. So in a nutshell, that's what we're working on.
Thank you so much, AJ. And once again, if you are interested in assisting with the youth homeless point in time count, you can actually participate in the general count on that Wednesday, January 26th, and then AJ will continue to implement the youth count for 3 days. So if you're interested in assisting, please let us know. Next slide, Monique. If you could take it all the way to the continue to that last part where it has the next planning meeting. Next, sorry. There you go. And so our next meeting is December 15th, 2021 from 2 to 4 p.m. We thank you so much for your participation and staying 5 minutes with us as we wrap up. Next slide. And if you have any questions, please don't hesitate to reach out to us. There's a lot of opportunities for you to participate, as well as your staff in your community. So don't hesitate to reach out to us and ask us how you can be part of planning this count. Thank you so much, and we look forward to seeing you on December 15th. And how do I pause? Did you pause that?
Mute yourself.